This is Thomas Good, a happy, joyful man, full of life, but it always wasn't like that. At the age of 34, he was diagnosed with multiple myeloma, a blood cancer. He was told he only had 3 to 5 years to live. He was furious. He wanted to overcome this label that he had just been put on his life. Time and time, fighting this disease, it would just keep recurring. He then realized what he had to do. Not being able to live his life continuing fighting this disease was not the way to go. So he started to help people who also have been diagnosed with this blood cancer. He later on helped funded the Triangle Area Multiple Myeloma Support Group in Durham, North Carolina. This is now his 13 years of having multiple myeloma. Thomas is the youngest of 11 brothers and sisters. When the news struck about the tragedy, the family came together to support him, even though they all live in different states. The doctors would use high dosage of chemotherapy because he was so young and he was so fit. The doctors tried using his own blood for stem cells, but it just wouldn't help. So he needed a blood cell transplant, so he looked towards his family. Out of the 11 brothers and sisters, there was only one who was able to help him. So his brother helped him transfer 2 blood cells into his body, and he is practically 98% of his brother. Now we will learn about some general facts of multiple myeloma, signs of having multiple myeloma, and getting involved in the process. Myeloma is a cancer of the plasma cells in the bone marrow. The malignant plasma cells accumulate in the bone marrow. According to www.myeloma.org, major features of myeloma form within the bone marrow, which cause disruption of normal bone function, destruction and invasion of bone and surrounding areas, production and release of protein from the myeloma cells into the blood or urine. Myeloma is a non-curable cancer. That is the second most common blood cancer in the world. There are approximately 229,460 people in the world with myeloma worldwide. There are 114,250 new cases a year. Myeloma can be caused by several factors. As a result, pre-myeloma populations in the bone marrow that are already abnormal or damaged may be affected. Some triggers are certain solvents, some fuels, engine exhaust, and some cleaning products. Signs and symptoms, according to www.myeloma.org, would be persistent or worsening tiredness due to reduced kidney function, sudden pain due to a broken bone in the spine, rib, or anywhere else, and pain with movement, pain endurance, and swelling of the bone. There's an estimated number of 95,688 people that live with myeloma in the United States. There was an estimated amount of 30,330 new cases of myeloma in the past 3 years. Myeloma is often found in men more than women, and is twice as common in people who have a descent of African. The range of average diagnosis is 65 to 74. Treatments, according to www.acccancer.org, include single or combination drug therapy, supportive care, high dosage of chemotherapy, radiation therapy, and a clinical trial. Ways getting involved would be joining Be The Match. Be The Match is an organization that helps people who have myeloma find matches. So what you would do, you would go on their website and register. Then they'll send you a swab kit. Then you would take the swab your cheek, then send it back to them. And then you would have the potential of saving somebody else's life. Joining a support group is not just for the patient. It's also for the family members of the patient, because knowing that your family is right beside you is the most important thing that happens. We have just now learned the importance of myeloma and some general facts of having myeloma and ways to get involved. Thank you.